Good evening. I'm Dr. Les Hall, Dean of the University of South Carolina School of Medicine, Columbia, and I would like to welcome you to the 2020 Alumni and Dean's Distinguished Service Awards virtual ceremony. Each year, the School of Medicine presents 7 prestigious awards to alumni who have made significant impacts on their communities, their patients, and the School of Medicine. We also present the prestigious William C. Gillespie Staff Recognition Award and the Dean's Distinguished Service Awards, which are annual honors specifically designated to recognize faculty, staff, and community members who demonstrate extraordinary excellence in service, leadership, advocacy, and professional accomplishment. Alumni recipients are chosen by a selection committee overseen by the School of Medicine Alumni Association Awards Selection Committee. The William C. Gillespie Award is chosen by a committee of peer staff members from clinical, research, and administrative areas. The Dean's Distinguished Service Awards are chosen by a select group of individuals representing the school's executive leadership team. In a normal year, we, along with the award recipients, their families, friends, and colleagues, would be gathered in person for a celebratory dinner, during which we would recognize each of the recipients for their accomplishments. As you well know, these are anything but normal times. Nonetheless, I believe we have put together a very special celebration that will truly honor our 2020 award recipients. One of the most positive aspects of a virtual event is that we are not limited by space, so the number of attendees can be virtually limitless. That means we have a lot more people joining us this year, and that's exciting. The downside is there is always the potential for things to go awry. If we do experience any technical difficulties, you can find a link to the entire pre-recorded event on our website at sc.edu/medicine. You will find the bios for each of this evening's recipients and the program for this event here as well. I would now like to ask Dr. Steve Corso, President of the School of Medicine Columbia Alumni Association Board, to come to the podium to introduce our 2020 Alumni Award recipients.
Good evening, everyone. I'm honored to introduce you to the 2020 Alumni Award recipients. Each of these individuals has gone above and beyond in demonstrating outstanding achievement in their professions, service to their communities, and/or to the school. I will announce each award, introduce the recipient, and then a brief recorded message from the recipient will follow. I know you will be as impressed as I am by their accomplishments. The first award we will be presenting this evening is the Distinguished Physician Alumni Award. This award is presented annually to the graduate who has exemplified professionalism, commitment, and dedication to the medical profession. The 2020 recipient is Dr. Lily Filler. Dr. Filler was already married and the mother of 3 children when she began her medical training at the University of South Carolina School of Medicine. After graduating in 1988, she completed her residency at Palmetto Health Richland in 1992. Dr. Filler then opened a private practice in obstetrics and gynecology, Women Physician Associates, which was the largest all-female practice in Columbia at the time of her retirement in 2014. Dr. Filler recognized that fundamental changes in patient care for women and insurance for oral contraceptives were only going to occur with medical political activism, and so she joined the Medical Executive Board at Palmetto Richland, was selected Chief of Staff in 2002, and became President of the Columbia Medical Society in 2003. She has been a fierce advocate for her patients and their rights. Congratulations, Dr. Filler, on your much-deserved award and your impressive career.
Thank you so much for this wonderful honor, and thank you to the Dean and the nominating committee for making this possible. Although I have been retired for 6 years, I recently, especially over the last 6 months, have been thinking about my colleagues who have had an unbelievable pandemic put upon them. We know that the healthcare field is an honorable one and a very heroic one. Every patient is always treated with dignity and respect, and we all do our very best. When I was working at Prisma, which then was Palmetto Health Richland, I was always so proud of the commitment to excellence that the staff portrayed. And I had the opportunity to work with the administration as well when I was chief of staff, and also saw the same commitment come forth from them, not only to the medical staff, but to the community at large. However, now we are in the midst of this pandemic, which has tried to outwit and outwork us as they do this to the first responders. But the first responders have become exhausted. It has taxed their resolve. We all must do our own part during this very difficult time. As an obstetrician, I know the additional stress that this puts on the patient, but the physicians are there to assess and reassure them at all times. I am proud of the medical field, and I am proud to be a part of it. And I want to thank all of those who are doing their part. We have a very talented medical community in South Carolina. We are lucky we have the strength to move on. And I am proud to be part of those ranks. Thank you again for this wonderful honor. I will always be a physician at heart.
The Distinguished Young Alumni Award is presented annually to an individual who graduated from the School of Medicine within the last 10 years and has exhibited excellence and leadership in his or her chosen field. This year's recipient is Miss Lenita Jefferson. Miss Jefferson is an adjunct professor in rehabilitation counseling. She received her Master's of Rehabilitation Counseling from the University of South Carolina School of Medicine in 2017. She is a licensed professional counselor and co-owner of Carolina Assessment Services, LLC in Columbia, where she specializes in treating individuals whose vocational levels of functioning have declined due to experiences of trauma, anxiety, and depression. Her work focuses on addressing those limitations to improve their quality of life. Ms. Jefferson serves as president of the Midlands chapter for the University of South Carolina School of Medicine Alumni Board and as co-chair for the Hollins University's Black Alumni chapter. She currently is working toward her doctorate in counselor education. Congratulations, Ms. Jefferson, and thank you for all you do to represent our school so well.
Hello, my name is Lenita Jefferson, and I am class of 2017 from the Master's of Rehabilitation Counseling at the School of Medicine. I am excited and beyond honored to be the recipient of the Distinguished Young Alumni Award for 2020. I think it's amazing to know that my work is going noticed in the community. I will continue to strive to live up to what it means to have the Distinguished Alumni Award for years to come. I also would like to thank the Masters of Rehabilitation Counseling program for all they do for their students and for the community at preparing us to be able to provide good quality client care out in the community, in private practice, or at the state level. I also would like to thank my wonderful support system, which of course I would want to thank my wonderful husband of 5 years, my beautiful children, and my beautiful fur babies, as well as I would like to thank my mother and father for being there for me and allowing me to, of course, be a mom with help and being able to build such a significant experience and support in the community as well. So again, thank you so much for this award. I am beyond excited and beyond honored to be the recipient for this year.
The Humanitarian Physician Alumni Award is presented annually to a graduate for distinguished human service contributions at the local, state, or national level with an emphasis on health and welfare. This year's recipient is Dr. Christopher Goodman. Dr. Goodman is an assistant professor of internal medicine. He received his medical degree from the School of Medicine in 2010. He then completed his internship and residency in internal medicine at Emory University in Atlanta. He currently serves as a medical director for Prisma Health Richland Hospital. His professional interests focus on quality improvement, social medicine, and interprofessional care. Dr. Goodman also works to establish partnerships to advance health for all people, from housing issues to access to life-saving medications for opioid disorders. He currently donates his time as co-medical director for the Good Samaritan Clinic and co-leads the Quality Improvement Education and Systems Collaborative, which pairs health students with mentors and clinical improvement teams. Congratulations, Dr. Goodman, and thank you for all that you do to help the underserved communities throughout our state.
Hey everyone. First, I'd like to thank the Alumni Association for this wonderful and surprising honor. I'm a proud USC School of Medicine graduate. I know that humanism really permeates what we do in our curriculum. I'd like to take a moment and recognize and give thanks to people around me that help make any giving possible. First, my family. My parents are constant examples in my life of self-sacrifice and really taught me and my sister how to extend love out to others. In my work life, there's been two key mentors, both at the School of Medicine, Drs. Donna Ray and Alan Brett. They've really taught me how to translate the abstract and things I've learned over the years about medicine and translating it into practice. Finally, my wife Sarah and our newborn Sophie, born just a few weeks ago, are constant sources of learning about both giving and receiving love. I think it's important in these moments of recognition of service to reflect on why that service is necessary. Some areas of work for myself and at the Good Samaritan Clinic or addiction medicine or housing advocacy in the community are all necessary because of societal needs, the vilification of immigrants, the inadequate housing funding and regulations and oversight policy, the stigma in our healthcare system about addiction. All of these are problems, and they're problems that motivate me and many others in the work that we're doing. I'm proud to receive this award and recognize it's on behalf of the people around me, the institution that values this work, and the changes that we all want to see in the world. Thank you.
The Distinguished Doctorate Alumni Award is presented annually to a graduate for significant accomplishments in research and teaching. The recipient this year is Dr. Lawrence Lamb. Dr. Lamb earned his PhD in experimental pathology at the University of South Carolina School of Medicine, Columbia, in 1991. His career has focused on cancer research, and he currently serves as the scientific co-founder, executive vice president, and chief scientific officer of Incisys Therapeutics. He completed 2 postdoctoral fellowships in transplant medicine at the South Carolina Cancer Center and 1 in the study of molecular genetics at the University of South Carolina. Dr. Lamb also holds a master's in critical care nursing from the University of South Carolina. He has 27 years of experience as a transplant immunologist and has developed the scientific support for chemotherapy-resistant T-cell-based immunotherapy for high-grade brain tumors. Congratulations, Dr. Lamb, and thank you for the important role you have played in advancing the field of cancer research and therapeutics.
Greetings from Hilton Head. First of all, I'd like to extend my thanks to the nominating committee for this honor. Looking back over my history with the University of South Carolina, I have to reflect on how remarkable and unexpected my journey from 1984 has been. The unmerited confidence placed in me by mentors who had nothing to gain from the time, effort, and frustration they must have experienced is a gift that inspires a gratitude that is beyond expression. I start with the late Dr. Carl Ullman, professor of surgery and chairman of the Department of Surgery, who encouraged me to accept the challenge of a career in medical science and provided a path that enabled me to begin this adventure. From Major General and Professor William Willoughby, whom with great patience taught me what it means to be a scientist. Professor Franklin G. Berger, who not only taught me the practical discipline of molecular biology, but also guided my next steps into a career that would take the next 30 years. Then there was Professor Adrian G., who took a substantial risk in bringing a 37-year-old postdoc with relatively thin credentials into the laboratory that would have been the envy of any student in the young field of cancer immunology. As his trainee, I was introduced to current and future Nobel laureates, program directors, and young scientists that years later continue to impact cancer research at a high level, many of whom I am humbled to call friends and colleagues. With Adrian's selfless guidance, I was able to pursue a chance observation that ultimately resulted in one of the most extraordinary privileges that can occur in a medical scientist's career: the ability to follow a finding from conception in the laboratory to application in the clinic. So I stand here with the highest respect and gratitude for the individuals from this university who invested in me, and I hope to be worthy of this honor. Thanks to all, and Spurs up.
The Distinguished Genetic Counseling Alumni Award is presented to a graduate who exhibits significant leadership and accomplishments as a genetic counselor. This year's recipient is Ms. Kate Wilson. Ms. Wilson is a board-certified and licensed genetic counselor at Quest Diagnostics. She earned her master's in genetic counseling degree from the University of South Carolina School of Medicine, Columbia, in 2007. She received her bachelor's degree in zoology and genetics from North Carolina State University. Ms. Wilson currently is a product manager at Quest Diagnostics, where she specializes in oncology and consumer-initiated testing. She also is involved with several genetic counseling training programs as a lecturer, supervisor, and thesis committee member. Additionally, she serves as a member of the board of directors for the American Board of Genetic Counseling and is active in the National Society of Genetic Counselors. Congratulations, Ms. Wilson, on your stellar career and for advancing the field of genetic counseling.
I am honored and humbled to receive this award. Thank you to the University of South Carolina School of Medicine and to the Alumni Association for the recognition. Thank you to the Genetic Counseling Program for the nomination. During my training at South Carolina, I had wonderful mentors and teachers, and I want to thank Janice Edwards as Program Director for the Genetic Counseling Program. Thank you to Vicki Vincent for her nomination, and to all the faculty who dedicated their time and expertise: Claire Singletary, Dr. Robert Best, Dr. Richard Ferrante, Karen Brooks, Jessica Hooks, and Andrea Sellers. Thank you to my classmates at South Carolina: Melissa Byler, Karen Corneliuson, Anna Hurst, Shobana Kubandran, and Holly Zimmerman. I also want to acknowledge my team at Quest Diagnostics. They support my growth and engagement in the field of genetic counseling. And cheers to my prior position and team at the UT Health Science Center, who pushed me to be more involved and who saw my potential even when I didn't. Thank you to my husband, my kids, my family, for continuing to be my North Star and keep me pointed in the right direction. Finally, thank you to all the patients and the families who have allowed me to be a part of their lives. Your challenges, your tenacity, your hope, and your love are remarkable. Thank you.
The Distinguished Masters Alumni Award is presented annually to a graduate for significant accomplishments in their chosen field. The recipient this year is Miss Ashley Waddington. Ms. Waddington is an adjunct instructor in rehabilitation counseling and counselor education. She is a 2016 graduate of the Masters of Rehabilitation Counseling program at the School of Medicine. In addition, she also is working toward her doctorate in counselor education. Ms. Waddington is an active member of the American Counseling Association. She has volunteered in activity therapy, teaches Sunday school to children at Epworth Children's Home, and has served as a rehabilitation volunteer. While attending the School of Medicine, she received the 2016-2017 Distinguished Rehabilitation Counseling Student Award. Ms. Waddington, thank you for the important work you are doing in training the next generation of rehabilitation counselors, and congratulations on your many achievements.
Hello, Hello, my name is Ashley Waddington, and I am the 2020 Distinguished Masters Alumni Award recipient for the University of South Carolina School of Medicine. It is such an honor to receive this award, and due to COVID and everything going on with the world, I'm thankful to be able to have an opportunity to express my gratitude and thanks for being able to receive this. And I guess we've all kind of had to adjust to technology changes and the way that the world has changed lately. So I'm just thankful to have this opportunity. The 2020 Distinguished Masters Award goes to someone who has one of three qualities, or all of the three qualities, within dedication to the field. They have made significant contributions to the field and also have exhibited service in the community. For me, I graduated in 2016 for the University of South Carolina School of Medicine in the Masters of Rehabilitation Counseling program, which has been the single best decision that I've ever made in my life thus far. And how I have kind of contributed to the community since graduating in 2016 is I have had many experiences within the state, private practice, working at a local college as a community mental health counselor within the college setting. And currently I co-own a private practice with a fellow alum from the Masters of Rehabilitation Counseling program, assisting people with mental health concerns. And that has been a fantastic way to kind of stay in the community and also stay connected to the School of Medicine and master's program. I also am an adjunct professor in the School of Medicine, and that has been a super fun experience to give back. I want to thank you so much for this opportunity. I am truly honored and blessed, and go Gamecocks!
The Alumni Association Honorary Life Membership Award is presented annually to an individual who did not graduate from the University School of Medicine, but nonetheless has exhibited a commitment to supporting and serving the school. This year's recipient is Miss Ruth Riley. Miss Riley is an Assistant Dean for the Executive Affairs and Director of Library Services at the University of South Carolina School of Medicine, Columbia. She earned her master's degree in Library and Information Science from the University of Illinois and completed her bachelor's degree in Sociology at the University of Kansas. She joined the University of South Carolina faculty in 2000. She has served as president of the Association of Academic Health Sciences Libraries, as chair of the Southern Chapter of the Medical Library Association, and chair of the Partnership among South Carolina Academic Libraries. I've been told that if anyone has questions about the School of Medicine, Miss Riley is the go-to person. She is always ready to lend a hand or step up when needed. She wears many hats for the school and is always willing to assist the development and alumni relations team. Miss Riley, thank you for your leadership and your commitment to the school. Congratulations on a much-deserved award, and welcome to the School of Medicine's Alumni Association.
I want to express my great gratitude and appreciation for receiving this award from the School of Medicine Alumni Association. It's wonderful, and I feel very humbled by it. I have been at the School of Medicine for 20 years, and I feel very bonded with the school and very committed to our mission to produce outstanding healthcare professionals for the state of South Carolina and for the United States. So I've worked in 3 other medical schools besides this one, and I can tell you this one is absolutely my favorite. So I'm just thrilled to receive the award, and I thank you very much.
Congratulations again to this year's impressive Alumni Award recipients. On behalf of the school's Alumni Association, I would like to say how very proud we are of each and every one of you, and how pleased we are to include you as members of our alumni family.
Good evening. I'm Derek Payne, Assistant Dean for Finance and Administration for the School of Medicine, Columbia, and it gives me great pleasure to recognize the recipient of the 2020 William C. Gillespie Staff Recognition Award. The William C. Gillespie Staff Recognition Award is named after a former employee who worked in the School of Medicine's finance office. It recognizes an outstanding staff member whose work performance serves as an example for all to emulate. The 2020 recipient of this award is Mr. John Crane. Mr. Crane joined the School of Medicine in 2009. While he has always provided exemplary service in his role in the facilities department, he has definitely gone above and beyond the call of duty during the COVID-19 pandemic, meeting each and every challenge to ensure the safety of our students, faculty, and staff. He responds to crises at night and on the weekends and drops what he is doing to assist our employees and students at any time. He is extremely deserving of this award, and that is why a committee of peer staff members from clinical, research, and administrative areas selected him as this year's recipient of the William C. Gillespie Staff Recognition Award. Congratulations, Mr. Crane, on being selected by your peers for this award. We appreciate all you do for the School of Medicine.
Hey everyone, just want to say thanks for the recognition. I think it's truly an honor to receive this award, and I appreciate it. Thank you very much.
Good evening. I'm Dr. Kaufman Taylor, Senior Associate Dean for the School of Medicine in Columbia, and I'm extremely pleased and honored to present the 2020 Dean's Distinguished Awards recipients. The Dean's Distinguished Service Awards are annual honors that recognize individuals who demonstrate excellence in service, leadership, advocacy, and professional accomplishment. The Community Service Award is presented to a member of the faculty, staff, or student body who has demonstrated a commitment to improving the welfare of all people and who has upheld the highest traditions of servant leadership. This year we have 4 recipients that will be receiving this award, 3 students and 1 staff member. The recipients are Ms. Alyssa Lee, Mrs. Christina Romano, Mr. Brian Holloman, and Mrs. Tisha McSwain. Ms. Lee is an MD program candidate in the class of 2022. She received her master's degree at Boston University School of Medicine before returning to her home state of South Carolina to pursue a medical career. She has helped establish the School of Medicine Community Service Group, and as president, Mrs. Lee encouraged student involvement with the Red Cross by organizing and planning blood drives on campus, and established a new partnership blood drive with the Columbia VA Health Care System. During the COVID pandemic, she has served as project lead for the Community Food Outreach Team for the COVID Midlands Outreach Initiative. The team served every meal for a month at Transitions, a local homeless shelter, and 500 food boxes were assembled and delivered to families in need through FoodShare South Carolina. Congratulations, Mrs. Lee, and thank you for your leadership in serving the larger community and our veterans.
Good evening, everyone. I would like to start off by saying what an honor it is to have been chosen for this award. This past year, my goal was to increase the active community service drive and participation across the medical campus. I'm happy to say everyone did a great job. Last year, with the help of Samantha White, Kaylee Day, and several other members of the USC family, the community outreach group came to fruition. Together, we organized the first blood drive that consisted primarily of medical student donors and volunteers. This was the start of a huge step in the right direction. In the spring, we successfully partnered with the VA for their Go Red blood drive event. We were so successful in our partnership that the VA was awarded a special grant for future initiatives. As spring continued, we were all met with the challenge of the coronavirus across the community. The community outreach group was happy to partner with several coronavirus outreach relief efforts. As project lead for the community food outreach team, I witnessed the giving and supportive nature of the students, faculty, and staff at the School of Medicine. I want to say thank you to everyone involved with the food outreach team for your hard work. Because of these initiatives, we now have student partnerships with several local food banks in Columbia. Today, I'm happy to serve as the volunteer coordinator in Florence, South Carolina, where I will be completing my clinical rotations. I'm hoping to expand the Spring VA Partnership Drive to include the campus in Florence as well. Additionally, I'm looking forward to the work that students will resume at Mercy Medical Clinic. Thank you again to everyone involved in these projects. I'm excited to see how student involvement in the community continues to grow across all campuses. Thank you.
Ms. Romano also is an MD program candidate in the class of 2022. She graduated from the University of Georgia with a bachelor's degree in biochemistry and molecular biology with research distinction. She and her husband Ryan moved to South Carolina after graduation to start their respective training in medicine and law at the University of South Carolina. When the COVID-19 pandemic hit, Mrs. Romano stepped up to the plate to spearhead and organize, with the help of the School of Medicine and the United Way of the Midlands, an outreach initiative with the Salvation Army, the Friendship, Midlands Gives Fundraiser, Food Share South Carolina, Transitions, and Prisma Health. The School of Medicine COVID Midlands Outreach Group was able to pack and deliver 500 meal boxes, pack 800 hygiene kits, deliver groceries for seniors, serve a month of meals, deliver community PPE donations to healthcare workers, and aid in raising $12,000. Thank you, Mrs. Romano, for your hard work and effort in setting into motion this incredible and multifaceted effort. You're an exceptional representative for your class and for the School of Medicine.
Hi, everyone. My name is Christina Romano. Thank you so much to the Dean's Office and the School of Medicine for this Community Service Award for the Midlands COVID-19 Outreach Initiative. We started really small, just me and some classmates, offering some senior mentors in the area and more at-risk faculty if we could go get their groceries and run errands for them. And then through the school, with Dean's Hall's help, he was able to connect me to Dr. Kristen Hairston. Thank you so much to her. Over at the Greenville campus in Prisma, my assigned mentor, Dr. Donna Ray, Dr. Eric Williams, all of these people, the School of Medicine pitched in to make this vision of being able to help out the Midlands and Columbia a reality. And through them, we were able to organize more than 80 volunteers, 3 different teams to help out more than, I think, 6 or 7 organizations over the course of the past 2 to 3 months. And we've also been able to make those relationships with those organizations something more permanent that future students can volunteer at. I want to thank my classmates and friends, specifically Lucy Pollard, Alyssa Lee, and Kara Joseph, who stepped up to help lead the 3 different outreach teams that we had. They just put in so much work and so much effort and just helped me out when I needed them. I couldn't have made it through this trying time without all of them. And I just feel so blessed to be able to help out the city of Columbia and South Carolina that I've grown to love. And I just pray that in future as a student and later on as a physician, I can keep finding ways to give back to my city. Thank you.
Mr. Holloman is a PhD candidate in immunology at the School of Medicine. He is also a decorated Army veteran, having completed a tour of duty as part of the global war on terrorism. Additionally, he is an entrepreneur and an adjunct biology instructor at the University of Maryland Global Campus. Mr. Holloman also is an activist who fights social injustice and a leader who has organized community-based events to promote STEAM careers in low-income communities. Holloman was selected to participate in USC's 2020-2021 Graduate Civic Scholars Program, which provides opportunity for interdisciplinary research, involvement in social justice initiatives, and an enhanced understanding of the role of scholarship in addressing societal needs. Thank you, Mr. Holloman, for your hard work, dedication, important advocacy on the behalf of social injustice, and leadership role you are taking in promoting STEAM careers in underserved communities.
Hey, my name is Brian Holloman, and I'm honored to be one of the recipients of the Dean Distinguished Service Award. As I reflect on the word service, it often leads me to think about one of the several core Army values I learned many years ago while serving in the military. It was selfless service. simply defined as making a sacrifice to service others. So, as I stand as the only African American male in the PMI department, and I think maybe the only African American male in the PhD program at the School of Medicine currently, I look to change that. So hopefully one day I won't be the only one in the room.
Ms. McSwain is a physical analysis in the Office of the Dean at the USC School of Medicine. She volunteers with two community organizations, Path to Redemption and Just Leadership USA. Path to Redemption provides services for those returning to society after incarceration. Their objective is to reduce recidivism rates by providing support system resources for expungements, job placements, tools for emotional intelligence, budgeting, ACA healthcare enrollment, work clothing, and voter registration information. She also works with Just Leadership USA to help people with convictions become gainfully employed. Last year, she worked to get the Ban the Box ordinance passed in cities across South Carolina, which removes the question from a job application asking if a person has a criminal record. Thank you, Ms. McSwain, for all the work you're doing to ensure equity and fairness for all individuals in your community, and congratulations on your award.
My name is Tisha McSwain, and I am one of the recipients of the Dean's Distinguished Service Awards. I'm honored that I have been recognized for some of the work that I do with two nonprofits here in South Carolina. Both of the organizations that I work with men and women that have been previously incarcerated as they're trying to reacclimate back into society. The first organization is Just Leadership USA. Just Leadership deals more on the legislative side of the rehabilitation process. We've been recently able to get several cities and counties across the state to pass Ban the Box ordinance. And what Ban the Box is, it is removing the question off of a job application that asks if a person has a criminal background. Now, it does not eliminate background checks whatsoever because background checks are still done, but it allows that person the opportunity to at least have an interview based upon their skill sets. In that interview process, the applicant will disclose with the employer, hey, when you run my background check, this is what's going to come up. These are some of the circumstances that surrounded that particular incident, and this is some of the steps that I've taken thus far in order to better myself. We realize that when a person's able to take care of themselves, they're able to take care of their families. When they're able to take care of their families, they're able to better take care of their communities, and in turn, the taxpayer has less of a burden to supply and to take care of that particular family and the needs that aren't being met because they are not working. The other organization that I work with is called Path to Redemption. And Path to Redemption deals with more of the emotional and mental aspect of rehabilitation. We help them deal with some of the triggers that they may face and some of their emotional intelligence and how to deal and how to face and how to overcome some of those frustrations that they may encounter. We also work with the families as well too, because there are adjustments that they have to make as they have a loved one who they haven't been with or lived with for some time. We also try to meet the needs of that particular person, whether it be housing, clothing, food, their social security card, their driver's license, the voter registration card as well. So, and we also deal with wayward youth as well too, trying to help get them on the right track. But like I said, these are two of the organizations that are close and near and dear to my heart, and I really appreciate the fact that that I've been recognized for this award this year. And when you get a chance, I ask that you go on social media and look up some of the work that we've done and some of the work that we want to continue to do. That's Just Leadership and Path to Redemption. Thank you. Bye-bye.
The Dean's Leadership Award is presented to a faculty or staff member whose outstanding leadership has contributed to the School of Medicine's success in advancing one or more of its missions. This year's recipient is Dr. Helmut Albrecht. Dr. Albrecht is the current Hayward Gibbs Distinguished Professor of Internal Medicine at the University of South Carolina School of Medicine in Columbia. He's an infectious disease expert physician with Prisma Health Medical Group and the former chair of the Department of Internal Medicine. During the COVID pandemic, He has served as a regional and national leader. His team conducted clinical drug trials, developed a treatment registry, and created treatment algorithms. He was heavily involved with the development of the convalescent plasma program at Prisma Health, which was the first in the state to recruit donors and the first to administer the convalescent plasma. Dr. Albrecht has educated others on COVID-19 through countless print and broadcast interviews. By serving as a spokesman, he has been an ambassador of the School of Medicine and helped highlight the level of expertise within the school. Dr. Albrecht, we appreciate all that you have done to elevate our medical school in the public eye, and in particular, the role you have played over the past 8 months in saving countless lives during the global pandemic. You're an exceptional leader, and you represent the very best of who and what we are as a school.
I'm honored to have been nominated and selected to receive this Dean's Award. Of course, when I get the award, it has to be in this crazy year. I doubt any of us will ever forget 2020, a year when COVID-19 not only affected all of our work, but really all facets of our lives. I understand that I was nominated for the award for the roles I've had in this pandemic. And while it's an honor to be recognized for the roles I've played, it's also humbling to have been singled out when this clearly has been the work of so many people. I gave my first talk on this in January, knew then it would have a major impact. One of the projects I've initiated at USC was an exchange with Nanjing University. We actually had our annual student group from Nanjing here in January when this unfolded in Wuhan. Nanjing is halfway between Wuhan and Shanghai. It was pretty clear from the students' description of what's going on in Nanjing, where they officially had very few cases, that this was going to be a real problem. It was clear something that spreads like a cold virus but can kill was going to be a problem, whatever you think it should be. I've worked through other epidemics, and I also knew that it would take a village to make an impact. I'm glad to have found other people here who wanted to be part of this village. Proud to have been part of this group. While I can't name you all, you know who you are. I want to thank you for your support and hard work with way too many 16-hour days for months in a row. But in the end, I think we've made a real difference here. While we do have to do this virtual this year, I fully expect to be invited back next year and A, get to spend a nice evening with all of you, and B, have something else in my hand that's not a diet ginger ale. So thanks again. Stay safe. We'll get through this. Cheers.
The Diversity and Inclusion Leadership Award is presented to a member of the faculty, staff, or student body of the School of Medicine who has implemented a project or program which has enhanced the climate of diversity and inclusion in the School of Medicine or advanced diversity and inclusion in healthcare disparities. The recipient for the Diversity and Inclusion Leadership Award this year is Dr. Claudia Grillo. Dr. Grillo is a research associate professor in the Department of Pharmacology, Physiology, and Neuroscience. She earned her doctorate from the University of Buenos Aires in Argentina. When Dr. Grillo joined the School of Medicine in 2003, she was particularly interested in training students from underrepresented groups. In 2013, she joined Broadening the Representation of Academic Investigators in Neuroscience, also known as BRAINS, a University of Washington-based and NIH-funded program designed to improve the career advancement of neuroscience scholars from underrepresented groups. She also initiated her own program funded by the National Science Foundation with the objective of providing research experience for college students from underrepresented groups. Through this NSF Fund grant, Dr. Grillo created a U of SC College of Charleston internship program that provides a laboratory research experience with stipend support for college students from underrepresented groups. Dr. Grillo, congratulations and thank you for your dedication to ensuring that students from underrepresented communities get exposure to the biomedical sciences and for encouraging them to consider a career path in the sciences. Your passion for promoting inclusion and diversity are making a difference and inspiring the next generation of scientists.
Good evening. I want to thank the School of Medicine, the Dean's Office, and of course our Dean, Dr. Hall, for this service award. And I also want to express my gratitude to my colleagues who noted my commitment and nominated me. Without their nomination, I wouldn't be here tonight. I was always concerned about disparities in our society, and I was always asking myself why some people cannot achieve their dreams even if they work hard, they have merits and abilities, and why they cannot be like the rest just because of their different background. And I think that the only way that we can combat those disparities is through education. And here is my contribution to fight those disparities at the School of Medicine. And I want to dedicate this award to all the students that I mentored through my career, and especially those that were coming from underserved communities and were able to achieve their dreams. And I want to dedicate this also to my parents, my teachers, my mentors, my family, especially my husband and my daughters who always supported me. And I want to invite all of you to fight against disparities and embrace diversity and inclusion. This brings a lot of joy to your personal and professional life and brings also long-lasting rewards. Thank you so much and have a great night.
The Sustained School of Medicine Service Award is presented to a faculty or staff member with at least 10 years of continuous service to the School of Medicine, who consistently demonstrates a commitment to improvement, exceeds his or her job responsibilities, and helps create a positive work environment. The recipient this year is Dr. Holly Lavoie. Dr. Lavoie currently is a professor in the Department of Cell Biology and Anatomy, as well as the course director for Medical Microscopic Anatomy. She joined the University of South Carolina School of Medicine faculty in 1999. She has taught first-year medical students microanatomy every year since then. She also teaches graduate and undergraduate courses. Her research focuses on female reproductive health, including ovarian function, fertility, and the effects of pregnancy and lactation on the heart. Dr. Lavoie served the School of Medicine Strategic Planning, Steering, and Education Committees and the University Committee on Tenure and Promotion. She currently serves as chair of the School of Medicine Basic Science Unit Tenure and Promotion Committee and as a member of the Curriculum Committee for the School of Medicine. Additionally, she is a grant reviewer for the USDA and NIH. She also serves with the Society for Experimental Biology and Medicine, has taught on the editorial board for Biology of Reproduction, and is associate editor of the journal Reproduction. Additionally, Dr. Lavoie is the incoming program coordinator for the South Carolina Embry Grant. Congratulations, Dr. Lavoie, on being selected as the 2020 Sustained School of Medicine Service Award recipient.
I'd like to thank Dean Hall for selecting me for the School of Medicine Distinguished Sustained Service Award, and I'd also like to thank those individuals who nominated me for this award. I've been at the university since 1999, and I feel very invested in the well-being and success of all of our students, staff, and my fellow faculty members, and I'm hoping that others will contribute to one or more School of Medicine committees and also to our research community through peer review and grant reviews.
The Friend of the School of Medicine Award is presented to a member of the community whose service to the School of Medicine has contributed to the advancement of the school's missions. This year, there are two recipients in this category, Dr. Everett Dargan and Dr. John Yarborough. Dr. Dargan is a retired cardiothoracic surgeon and educator. Born in Columbia, South Carolina, he earned a scholarship to Morehouse College at a young age of 15. He later graduated from the University of Buffalo with a bachelor's degree in biology and from Howard University College of Medicine with first prize honors. Following his internship at Brooklyn's Kings County Hospital, he served as chief resident at Albert Einstein College of Medicine, Bronx Municipal Hospital. Dr. Dargan served in the Air Force as a captain and commander during the Korean War. He completed cardiovascular and thoracic specialty training at Boston City Hospital, then returned to New York to teach at the Albert Einstein College of Medicine as an associate professor of surgery. He has also served as chief of surgery at various hospitals in his career. Dr. Dargan continued his deep commitments to providing quality medical care to military veterans and to minority and underserved communities when he returned to Columbia in 1978. He worked for decades at the Dorn VA Medical Center, at Richland Memorial Hospital, also serving as chief of staff, and as clinical associate professor at the School of Medicine. Dr. Dargan received a congressional tribute from Congressman James Clyburn in 2005 for his career's work. The same year, the School of Medicine established a scholarship to recruit underrepresented minority students to honor Dr. Dargan's legacy as a teacher and physician. Today, the Dargan Scholarship supports 3 students per year and enables the School of Medicine to attract and retain top-ranked students and advance its educational mission to prepare the next generation of South Carolina healthcare professionals. Dr. Dargan, thank you for playing a key role in establishing this important scholarship, and congratulations on what has been a truly inspiring career. We are so very fortunate at the School of Medicine to have someone of your experience and caliber to teach our medical students and inspire them.
Thank you, Dr. Taylor, for your kind introduction, and thank you for this tremendous honor. Perhaps at no time in our lifetimes have we needed more dedicated medical scientists and physicians who are informed by training, knowledge, research, and moral reasoning. Patients and their families depend upon us. In addition to the awesome responsibility of saving lives and comforting the afflicted, physicians bear the burden of insight. We often know why the patient is sick. We know when it would not be possible to save a patient. And more devastating, we know when intervention has been too late. I'm reminded of the first physician identified in history by the name of Imhotep, an African who was an advisor to Pharaoh Zoser. Imhotep said then, as I say now, the physician must first do no harm. The medical challenges brought on by the COVID-19 pandemic have also made it clear that deep racial inequities exist in the determinants of health. These inequities contribute to vast differences in medical outcome for patients. Many of the physicians educated at the University of South Carolina will work in underserved communities. Effective medical care is personal. The compassion that students learn here is as essential as their anatomy classes, research studies, and clinical experiences. Empathy is what facilitates the trust relationship between physician and patient, and it's what reminds us to maintain our humility and humanity. This institution stands for educating physicians with all of these qualities. Your commitment to imparting this solemn responsibility to successive generations of physicians has been why I have maintained close ties to the University of South Carolina School of Medicine. Thank you, Dr. Hall, for your stewardship of the medical school and for your dedication to excellence in education. Thanks to the university at large, specifically to the School of Medicine faculty, staff, and students, and to Prisma Health. Thank you for this great honor.
Dr. Yarborough has served as an affiliate faculty member in the Department of Cell Biology and Anatomy at the School of Medicine since 2011. He received his MD degree from the Bowman Gray School of Medicine and completed a residency in general and thoracic surgery at Duke University. After working in North Carolina and Nebraska, Dr. Yarborough moved to Columbia to join Thoracic and Cardiovascular Associates, where he practiced at Providence Hospital until 2007. Upon retirement from clinical practice, he began volunteering first in the School of Medicine Department of Radiology and then in the Department of Cell Biology and Anatomy. For the past 10 years, Dr. Yarborough has tirelessly volunteered as a mentor and assistant in the School of Medicine gross anatomy courses. In the lab, Dr. Yarborough circulates from table to table, helps the students become at ease and familiar with the art of dissection. He quizzes the students and challenges them to think critically and clinically. His service has contributed significantly to the advancement of the School of Medicine's educational mission and helped prepare the next generation of South Carolina healthcare professionals. Thank you, Dr. Yarborough, for all you've done to improve the educational experience for our students and for serving as such an incredible mentor and representative of the School of Medicine.
It's impossible to express how honored and humbled I am to receive this award. However, I might say that perhaps the title is a bit incorrect. For you see, it is not I who has been a friend to the university, but instead I have been befriended by the university. In 2007, when I retired from clinical practice, I was anything but prepared for the void left in my life. Fortunately for me, a good friend, Dr. Francis Neifer, invited me to talk to the medical students in their radiology class about abdominal aortic aneurysms. He then mentioned that I might like to stop by the anatomy lab and observe the students in action there. That is where I got to meet the most unbelievable faculty and teaching assistants imaginable. Not only do they prepare excellent lectures and PowerPoints with boundless enthusiasm, but they work one-on-one in the lab with every student according to their needs. They show genuine interest in the students, knowing not only their names, their personalities, but their personal lives as well. And they have welcomed me with the same kindness and enthusiasm. As a result, I have been able to learn from them and from a great group of young students as well. For that, I will always be grateful. Thank you.
The final award I will be presenting this evening is the Career Achievement Award, which is presented each year to a member of the faculty or alumni of the School of Medicine who has made significant contributions to their profession and whose career has spanned at least 25 years. This year, there are two very deserving recipients, Mrs. Janice Edwards and Dr. James Stallworth. Mrs. Edwards is a clinical professor in the Department of Obstetrics and Gynecology and director of the School of Medicine Columbia Genetic Counseling Program. She has practiced as a genetic counselor for nearly 40 years. As a clinician educator, she has trained and mentored over 250 genetic counselors. She was instrumental in developing the curriculum for the Master of Science Genetic Counseling program, which accepted its first class in 1985. The program was the first in the Southeast and was one of only 10 such programs nationwide at the time it was established. Professor Edwards is founding president of the Transnational Alliance for Genetic Counseling, a network of genetic counselor education programs from more than 20 countries. She has served on the boards of the National Society of Genetic Counselors, the American Board of Genetic Counseling, and the Association of Genetic Counseling Program Directors. The NSGC has honored her with their Regional Leadership and International Leader Awards. Her work with multiple national organizations have facilitated consensus statements on emerging issues in prenatal genetic testing. She has also directed genetic education conferences regionally, nationally, and international. I have known Professor Edwards for many years, and I can personally say that she has put our medical school and university on the map when it comes to her reputation and work in the field of genetics and genetic counseling. Congratulations, Professor Edwards, for this much-deserved recognition.
Thank you. Thank you so much for this honor. And really, thank you for the opportunity to stop and reflect on what's almost 40 years as a genetic counselor at the USC School of Medicine. What a privilege it's been. I've thought about all the people, all of the patients and their families that I've served over all these years, and what a privilege it's been to be part of their lives. I've also thought about the genetic counseling colleagues I've worked with. What a team they are, both as patient providers and as educators. And really the entire School of Medicine faculty and staff, how supportive they've been over the years for helping us build what we have today. I think even about our regional genetics centers and all my genetics colleagues in the state and outside that have been helpful to what we're doing at School of Medicine and then nationally and truly also internationally. It's really about the people, isn't it? That's what your career is. It's the people you work with, the people that you serve. And I can say without a doubt that these 40 years at the USC School of Medicine have been absolutely wonderful. Thank you so much for recognizing me in this honor.
Dr. Stallworth is a professor, vice chairman for education and faculty development, and clerkship director in the Department of Pediatrics. He also is assistant dean of admissions and director of student recruitment for the School of Medicine. As a premier and beloved teacher, he's been recognized through numerous teaching awards, including the O'Neill Barrett Teaching Award, Faculty Teacher of the Year, and the university's Michael Mungo Graduate Teaching Award. Additionally, he's received the prestigious Alpha Omega Alpha Robert J. Glaser Teaching Award from the Association of American Medical Colleges. He has been the Pediatrics Clerkship Director since 1986, and over the course of the last 29 years, medical students have maintained scores on the MB-ME shelf test consistently above the national average. He also is the Medical Director for the Physician Assistant Program and leads the successful Finding Your Future Shadowing Program for prospective medical students. He has been a leader in the South Carolina chapter of the American Academy of Pediatrics and received the President's Award and the Special Achievement Award for his work. Dr. Stallworth's scholarly activities include more than 30 publications in peer-reviewed journals, 7 book chapters, and more than 10 grants exceeding $2 million. He's a valued friend and colleague, and one that I've enjoyed knowing and working with for many years. Congratulations, Dr. Stallworth, for an incredible career and this much-deserved recognition.
Hello, I just want to use this time to thank you so much for the honor that has been bestowed upon me, especially, obviously, USC School of Medicine, my own Department of Pediatrics, and Prisma Health. When the dean actually called me about me winning this award, he made the comment about this being for recipients who were sort of at the end of their career and ready for retirement. And luckily he said this in a very jovial way and wanted to be sure that my winning this award did not represent some hidden agenda on his part, at least. But then again, there's always maybe some truth to these sorts of comments. But that being said, I just find it to be such an honor and a privilege to certainly have been able to be a physician educator and having been in that capacity for 42 years. And to be here at USC School of Medicine, which has always supported educational efforts for our students and allowed me to be the educator that I am and allow me to pursue my professional goals and objectives. So I'm thankful for each day of realizing the great things that our students have done, that our graduates have done and continue to do, not only in the field of medicine, but also for their community. And I selfishly hope that I have played a small part in their successes. So once again, I appreciate everyone's support and certainly thank everyone again for this wonderful tribute.
I would like to thank Kaufman Taylor, Derek Payne, and Steve Corso for your assistance in presenting this evening's awards. I would also like to thank each of the 2020 recipients for allowing us to honor them this evening. Each of you is doing extraordinary work. You're making a difference in your communities, in the lives of our patients, our students, and in our school. You are advancing research, improving healthcare, promoting diversity and inclusion, serving as mentors and role models, and making a tangible difference. To all of you who are able to join us this evening, thank you. I hope you enjoyed learning about the recipients and celebrating their achievements with us this evening. There is so much to celebrate and in which we can take pride. I wish everyone a good night.